Hello everyone, Leslie Cornwell, Midwifery Business Consultation. This video is more for consumers and clients, but it'll help midwives out as well about COVID-19 coronavirus. It's a worldwide pandemic, started the end of December, and it's really starting to ramp up in the United States. So our phones are ringing off the hook at the birth center, women with lots and lots of questions, and we don't have much for answers for them. There's not a lot of research with pregnancies. There's not a lot of research with the current CDC guidelines of isolation precautions in the hospitals. So there's a lot more questions than there are answers. And it's hard when you're trying to take care of women, decide who do you have to see, when you're getting triages of lots and lots of phone calls, where are the priorities, who to talk to, how do you mass communicate to your practice to keep everybody in the loop of all the changes? What resources are you sending them to? Because you may not have all the answers, but if you can find some good solid resources to send them to keep up on things, will help. So keep up with your practices guidelines. They're ever changing in the hospital, especially every hour, not just days. The guidelines and recommendations are changing to what is the newest research, what is the newest recommendations. As far as a private midwifery practice, birth center practice, just reinforcing to your moms, the immune boosting benefits for similar to the flu. You want to wash your hands, you want to not touch your face, you want to clean your surfaces, you want to quarantine yourself the best you can, go to only necessary things, your family. The challenge with COVID-19 is there's so many symptoms people can have. Some people don't have any symptoms. There's studies coming out 50 to 70% of the population doesn't have symptoms walking around with it. And then 15% are getting hospitalized, and some are saying 1% up to I'm seeing 4 to 5% of a mortality rate. So every country is different depending on how they prepped and their healthcare system and their resources. So it's a really serious virus that's going around the world, and we want our women to be safe. Some of the recommendations are to separate the babies after the mom is born, and there's no good data to say, should these women be breastfeeding? Is there any transmission during pregnancy? We don't know much, and so it is hard to give guidelines. We're trying to be protective and cautious with our mamas, but we just have to reinforce choices and options and help them make the best decision for them. So please keep in contact with your midwife. Do good evidence-based research on what's happening internationally. The World Health Organization is a great place. The CDC has some information. Just look at what other countries are doing and see, compared to our country, what prep we've done compared to other places, and see what you can control. We can't control government positions. We can't control supply issues. We can't control a virus that's sweeping over the world, but what can you control with your practice, with your life, with your family, and make these big decisions that's best for you. So please subscribe to the channel, watch more of the videos, and keep up with the data that's ever changing. Protect your family. I'm Leslie Cornwell. Thank you.